Hey, welcome to The Explainer. Today, we're talking about an injury that affects millions, especially our elderly and people with limited mobility. Now, you've probably heard it called a bed sore, but we're going to dive into what a pressure injury really is, and most importantly, how you can stop one in its tracks before it ever even begins.
So, let's just start with a question. What do you think of when you hear about something that starts as just a little red spot on the skin, but can actually become a severe, life-threatening condition if it's ignored? Well, the answer is a pressure injury, and that's exactly what we're breaking down today.
Okay, let's get right into it. The official name for what most of us call a bed sore is actually a pressure injury. And you know what? That name tells you pretty much everything you need to know, because the main cause is surprisingly simple: pressure.
So what is a pressure injury? Well, think of it as localized damage to your skin and the tissue underneath. It almost always happens over a bony part of the body, like the tailbone, the heels, or your shoulder blades. It's caused by intense or, more often, just long, steady pressure. It's basically your body's own weight acting against it, squeezing those tissues between a bone and a hard surface.
But you might be wondering, okay, it's pressure, but how does that actually harm you? It's not just a simple bruise. It's actually a pretty nasty chain reaction that starves your tissues of everything they need to survive. It happens in a few key steps.
Okay, so here's where it gets a little technical, but stick with me, it's actually pretty straightforward. It all comes down to the numbers. When the pressure on the outside of your body gets higher than the pressure inside your tiniest blood vessels, we're talking about your capillaries, it literally pinches them shut. I mean, it's just like stepping on a garden hose. No water gets through, right? Same thing here, no blood gets through. And when there's no blood, that means no oxygen. And tissue without oxygen, well, it starts to die. That's what we call necrosis.
And listen, pressure isn't the only villain here. It has a few partners in crime. Friction. Yeah, that's pretty simple. It's just skin rubbing on sheets, taking off that top protective layer. Now, shear is a little sneakier. Picture this. You're sliding down in bed. Your skeleton moves, but your skin kind of gets stuck on the sheets. That creates this awful internal stretching and tearing force. And then there's moisture. That just makes the skin all soft and weak, making it super easy to damage.
Now, this is super important to get. Pressure injuries don't just appear out of nowhere fully formed. They actually get worse over time, through 4 distinct stages. And knowing these stages is everything, because it's how you catch them early.
All right, stage 1. This is your big, red, flashing warning sign. The skin is still totally intact, but you'll see a red patch that might feel a little warm. Now, here's the key test. It's what we call non-blanchable. If you press on your own healthy skin, see how it goes white for a second and then turns pink again? With a stage 1 injury, you press it and it just stays red. That's a huge sign that there's trouble under the surface. But, and this is the best part, if you catch it here, it's completely reversible.
Okay, moving on to stage 2. This is where the skin actually breaks open. You might see a blister pop up, or maybe a shallow sore that looks kind of like you've scraped your knee. We've lost the top layers of skin now, so we're officially dealing with an open wound.
By stage 3, things have gotten a lot more serious. The damage has burrowed down way deeper, right into the fatty tissue under the skin. The wound literally looks like a crater now. You can see this sort of yellowish fatty tissue inside, but you can't see muscle or bone just yet. This is a very deep, very serious wound.
And then there's stage 4. This is the most severe, the absolute worst-case scenario. The damage is so bad, so deep, that you can actually see muscle, tendons, or even bone. At this point, the risk of a life-threatening infection getting into the bone or the bloodstream is sky high. This isn't just a wound anymore. It's a full-blown medical emergency. Now, really quick, there are 2 other categories you should know about, because they don't quite fit the 1 through 4 stages. First is unstageable. This means the wound is covered with so much dead tissue, like a scab, that you just can't see how deep it goes. The other is a deep tissue injury, or DTI. This one looks like a really, really bad bruise, a deep purple or maroon color. The skin hasn't broken yet, but it's a giant red flag that serious damage is happening underneath. Okay, that was pretty grim, I know, but let's shift gears now to the most important part of all of this. Seriously, let's talk about your prevention playbook, because stopping these injuries is 1,000 times better than treating them.
The first rule of prevention is knowing who's most likely to be affected. So, who is most at risk for developing these injuries?
There's actually a fantastic little memory trick for this. Just remember the word immobile. I is for immobility, that's the big one. M is for malnutrition, because if your body doesn't have the right fuel, it can't keep the skin healthy. Another M for moisture. O for old age. B for bony prominences. I for infection.
L for low sensation, like from diabetes, where you can't even feel the pain that would normally tell you to move. And E for edema, or swelling. So if there is one single thing, one number, I want you to burn into your brain from this whole explainer, it's this one, 2. Just 2 hours. Repositioning someone in bed every 2 hours, and even more often if they're in a chair, is the magic bullet. It lets the blood flow back in, relieves that pressure, and can single-handedly prevent these injuries from ever even starting.
But turning is just piece number 1. You've also got to have amazing skincare. Keep it clean, dry, and moisturize. Nutrition is huge. We're talking high protein, vitamin C, zinc, all the good stuff that skin loves. You can also use special pressure-relieving mattresses. And, even something as simple as keeping bed sheets smooth and dry makes a huge difference. And finally, you have to assess. Every single day, do a quick check of the skin. That's how you spot a stage 1 while you can still do something about it.
But okay, what if an injury does happen despite our best efforts? Well, the way we treat them lines up perfectly with the stages we just went over.
It really just makes sense, right? For a stage 1, the goal is super simple. Just get the pressure off. That means repositioning and maybe using a protective cream. For a stage 2, now that the skin is open, you've got to keep it clean and protected. But once you hit stage 3 and 4, well, the treatment gets way more intense. We're talking about removing dead tissue, strong antibiotics, and sometimes even surgery to close the wound.
And there's a really good reason why the treatment gets so aggressive. A deep pressure injury is basically an open door for some truly horrible infections. Sepsis, where an infection takes over your entire body, or osteomyelitis, an infection that gets right into the bone. Both of these can kill you. And that really brings us back to the main point, doesn't it? Prevention isn't just better than a cure, it is literally life-saving.
So look, if you walk away from this with just 3 things, let them be these. Assess daily, turn frequently, and nourish properly. Do those 3 things, and you're giving yourself or the person you care for the best possible defense.
So we've gone through the what, the why, and the how of these hidden injuries. The information you have now is a seriously powerful tool. So the only question left is this. Now that you know the signs to look for, who are you going to protect?